as I say, Louise has just very clearly described the expectations that NIHR have of the applied research collaborations in relation to NIHR's investment in the ARCs. And what I'm going to talk about briefly now, and more people will talk more about it over the rest of the morning, is about how ARC West hope to meet those expectations over the next 3.5 years. And I'm John Macleod. For those of you who don't know me, I'm the director of ARC West. And for those of you who are less familiar with ARC West in terms of who we are, what we do, how we do it, I mean, Louise gave a very good overview. Zoe is also going to post in the chat a link to our website where you can find out more about us. But to summarise and to set the context, we undertake the co-production of applied health research with our stakeholders, who include the public, in 4 themes that were decided in consultation with our stakeholders and reflect the priorities for health and care research in the West, reflecting the needs of the people that we work with. And those 4 themes are represented on this slide, and you'll be hearing more from the leads of those themes later on this morning. But the public health and prevention, mental health, integrated and optimal care, and healthier childhood. And we co-produce research, applied research in those themes with our methodological teams. And those teams are also arranged in 4 cross-cutting themes that are represented on this slide: in applied data science, that is led by Yoav Ben Shlomo; in evidence, that's led by Julian Higgins; in health economics, that's led by Will Hollingworth; and in behavioural and qualitative science, led by Lucy Yardley. And what we've been doing over the last 18 months, since we started on the 1st of October in 2019, we've been continuing the programme of work that we started under Clark West, our predecessor organisation. We've also, over the last year, been responding to the immediate strategic needs of our health and care system related to the pandemic, and Louise said a little bit about that. But the other thing we've been doing is through a research prioritisation process, arriving at a work plan for what we do for the rest of our lifetime, and looking towards the future and what's next for us. That's what our focus is this morning. So that prioritisation process involves research oversight groups that exist in each of our clinical themes, and those are stakeholder coalitions made up of people who provide health and care, people who commission health and care, professional academics, public health professionals, and public contributors. And those research oversight groups meet, and people come to those meetings with the priorities from their particular part of the health and care system. And in the groups, we discuss those priorities and decide on the priorities that we share across all our health and care systems in the West. And based on that, we rank those priorities to decide on which are the most immediate ones. And then that draft work plan based on priorities is reviewed, sense checked in a way, and then signed off by our research advisory panel, which is made up of senior academics and senior system leaders. And from that draft work plan based on priorities, we then work in each of our research oversight groups with our methodological teams and our public contributors to change those priorities into actual projects that we will undertake over the next 3.5 years. And that process took place over last year, continued over the beginning of this year. And just last week, we shared our work plan of the actual projects that we hope to undertake to highlight areas where we hope people like some of you will work with us. I'm just going to talk a little bit about what the priorities are in each of our clinical themes. You're going to hear more about the projects related to those priorities from the speakers who are going to talk after me this morning. So in public health and prevention, our priorities are around mitigating the impact of air pollution on health through adapting local transport systems, and also on population health management, which basically means the use of integrated data from the health and care system to drive both better care and also to inform a more effective local public health strategy. In integrated and optimal care, our priorities are around responding effectively to needs associated with frailty and complex multimorbidity, and also trying to bring about better end-of-life care. And we're also looking at the effectiveness and the acceptability of social prescribing. In mental health, our priorities are looking at problems of fragmentation of care, particularly at the interface between primary and secondary care. I work as a GP in Hartcliffe, one of our most disadvantaged communities, and particularly we're looking at how the needs of people whose complexity means that their needs cannot be completely met in primary care, how we help them live better. And also, as Louise mentioned, we have a priority around the prevention of self-harm and suicide. And in our Healthier Childhoods theme, which we'll hear more about later on, our priorities are around improving the mental health of children and young people, and in mitigating the impact of adverse childhood experience through more effective health and care policy. Louise mentioned the fact that that most of the ARCs have a responsibility around providing national leadership, and our responsibility in that regard is around applied health informatics, and we work very closely, as Louise mentioned, with Health Data Research UK, the national organisation driving the better use of big data to improve health. A year ago, we were successful in our application to become a partnership site of Health Data Research UK, and that's a collaboration with Penn ARC, our sister ARC, with 3 universities, and with the Healthier Together ICS, and Better Care South West is focused on using data better to improve care and to support population health management, as I mentioned on my previous slide. At the end of last year, we held a joint event with HDR UK on the use of administrative data in applied social care research as opposed to healthcare research. Nearly 200 people attended that event, and we had very positive feedback from it. Also, and Louise also mentioned this, we co-lead with UCL one of the COVID-19 national core studies set up by Patrick Vallance in the middle of 2020, essentially intended to provide the evidence to support the national response to the pandemic, and we co-lead the Longitudinal Health and Wellbeing National Core Study, which is focused on the creation of a research platform through enhancing 15 English Vanguard cohort studies with linkage to health and social care data. To say a little bit more about our ongoing response to the pandemic, that involves several projects, some of which I've highlighted on this slide. I won't say very much about some of them because you'll hear more later on. Paul Moran will be telling you about NHS Check. Jeremy Horwood will be telling you about Commons, and I think Jeremy will probably also say a little bit about Germ Defence, which is a digital intervention developed by Lucy Yardley to reduce the transmission of COVID, and we've rolled it out to all English practices. I'll also mention convalescence. Convalescence is a recently funded study based on a large collaboration that we are part of, looking at long COVID, looking at risk factors for long COVID, looking at how long COVID is diagnosed, and looking at how common it is and how it can be effectively treated. And that's a study based on the longitudinal health and wellbeing platform that I mentioned in my previous slide. As well as all this applied health research, we will continue to do the other things that we do. For example, our programme of training and capacity building that's led by our partners in the University of the West of England and the University of Gloucestershire, and that is focused particularly on the training and capacity building needs of nurses, midwives and allied health and social care professionals, and now includes an extensive online offer. We will also continue to develop our work in patient public involvement and engagement. We are currently developing and finalising our new PPI&E strategy. We have both regional and national reach with our PPI&E, including in relation to some of the national projects I recently mentioned, and we're widening participation and providing opportunities for wider participation, particularly through the use of digital platforms. We want our research to have impact. We don't take impact for granted, and because of that, we embed a research impact plan in each of our projects, and we also want to share and communicate the results of what we do with all our stakeholders, with all of you. And our communications team who organised today's event don't just have a regional role. Also, our team are the national leads for communication across the ARC network. So that's a very brief summary of who we are, what we do. Everything we do obviously is supported by our fantastic team, including our fantastic admin team, who I must mention as well. This photograph on this slide of many members of our team was taken just a little more than a year ago, obviously when we lived in quite a different world where social distancing was not a feature of our everyday lives. We're excited about the next 3.5 years. We hope this morning to share some of that excitement with you. We hope you ask us questions. You'll have an opportunity in a minute to ask me some questions, and we hope you give us feedback on what you felt you got out of attending this meeting, so that we can make future meetings better. Thanks very much. I'll pass back to Mark to chair the questions.